Ayurveda science today. Someone lying down, blissfully taking the Shirodhara, and that's Ayurveda. That is not it. That is a preoperative procedure. That is a conditioning procedure. That's a stage where we are dissociating the toxins from the tissues. Next comes the domain of Shodhana or cleansing proper. And this cleansing can be done through Vamana or programmed regurgitation or making someone vomit. It's not as uncouth as I'm telling, it's done in a very programmed manner. Then Virechana, which is an exit route through the downward channels. Vasti, we make use of the colon for the therapeutics. The medicines, the procedure spreads, the activity of these medications used spread across each and every cell of the body. Then Nasya, the medicine is given through the nose and it gets absorbed into the system. It detoxifies. We can see changes in CT scans or MRI reports later. So whatever we are able to do through these panchakarmas are reflecting in today's standard diagnostic methods. This has been the biggest positive advantage to show the scientific nature of Ayurveda. Rakta Mokshana is a technique which is more advocated by the Sushruta Samhita, wherein localized or generalized accumulation of toxins and disease causing, it can be hormones, it can be chemicals, it can be drained out of the system. There are again multiple methods of doing this. In today's short session, it is too much of an information to be compressed into a 1 hour session, but I'll take a general view on what we can achieve through the system of Panchakarma or Ayurveda in general. In a condition of psoriasis, you can see it's quite intense. I'm not very sure if the situation is okay. So, after a thorough Shodhana or Virechana based medication and therapy, we followed up for the 1 whole year through the seasons, and we documented the same condition after exactly 1 year in February, because the aggravation of some of the respiratory and skin conditions happened during change of seasons, or in Vasanta Rutu at times, or in monsoon. So when we documented after 1 year, we could see a near total, I would not say cure, because it's been about 8 years since then. The patient is having very, very minimal manageable levels of psoriasis. So this is what we could achieve through a Shodhana based technique. Then comes intervertebral disc prolapse. This is one area which is having so many multiple divided opinions. Someone goes to a yogacharya, he says he can manage it with yoga. Someone says through physiotherapy. Someone says immediate surgery is required. Someone says medicine is necessary, nerve blocks are necessary. So it's been a very, very complicated system. People suffering from intervertebral disc prolapse. And it gets more complicated when we see the MRI reports of patients who have walked into the clinic looking like having a little discomfort, but the MRI report looks like a disaster. They should not be up and walking as per that report. But the patient is seemingly okay, and sometimes there is a small impingement and patient is bedridden. So this is the kind of inconsistency. Can we base everything on the MRI report and start treating it without seeing how much the patient has adapted to the changes? It's very difficult to say that. So if the level of inconsistency is so high in structural changes like intervertebral disc prolapse, we need to take a subjective view of things also, not only objective views. The disc has been compressing the spinal cord. but the patient has adapted to it. Maybe he has scaled down his activity levels, or maybe he has found out different ways to manage itself. See, the body is very, very, very complex, and it has a very, very high levels of adaptability. When these high levels are trespassed or crossed, that is when the disease starts showing up. I will just take you through this one condition. You can see the L5S1, the intervertebral disc, and this is the spinal cord. This is compressing the spinal cord to such an extent that it's almost near total compression is there. The patient is showing features of almost being paralyzed. He's not able to get up, walk, do anything. Pain. No painkillers are helping him. This is such a situation. And this is the view taken from above. You can see the spinal cord being compressed by the prolapsed intervertebral disc. So after about 4 weeks of therapy, the patient started feeling better. So we thought, why can't we repeat an MRI and screen where we stand? Is it that the pain is managed, or is it that structural improvement has settled in? So just out of curiosity, we asked, let him repeat the MRI. Now we can see the spinal cord is totally free. Not totally, it looks like about 90% or 95% better. So he's a happy man. This is a person aged about 35 years, in the prime of his professional career. He is unable to stand, he is unable to walk. Every half an hour of sitting, he requires 10 minutes of lying down. This condition, this severe condition, where the patient is endlessly going between ortho and neuro and building up files after files, ending up in the hands of just physiotherapists, or ending up in the domain of just exercise. It's very difficult. So this is the extent of decompression of the spinal cord, which could be achieved in this case. Structurally also, we can see the changes. Many times what happens, as I said, we have to assess the condition both subjectively and objectively. I can give you one more example of one person having two seemingly unrelated conditions. Severe colitis. It was diagnosed as IBS, Crohn's, irritable bowel syndrome by various institutions spread across 2-3 countries. The patient was given immune suppressants, the patient was given so many methods and techniques. The intensity was such that the patient had to go about 30 times to the toilet. That was the kind of diarrheal phase the patient used to suffer. This is the main problem. When we started medicines, considering it as Pravahika or Atisara in Ayurveda, Grahani dosha, the patients did not respond to the extent we expected the patient to. In case of instead of 30 bouts of loose bowels, even if it is 25, it means something. We are going somewhere. That did not happen. Then when we went through all the files again and to see if we have missed on anything, have we missed anything? Then we saw the patient was on 125 microgram of L-troxin, thyroid supplement, because the patient was hypothyroid. That also correlated with the patient's reports. His condition required, in this case her condition required 125 microgram of supplementation to keep the thyroid levels normal. Next step, we thought, is the patient reacting to this L-troxin? Because higher level of thyroxine hormone can create or mimic a diarrheal phase. So what are we doing here? If that is true, that the patient is hypersensitive to this supplemented thyroxine, which has translated and which has been reflecting as diarrheal phase, we have missed a major aspect. So we thought in a monitored way we will stop the thyroxine and see. When we did that, spread across about 25, 30 days, and every week we started seeing the levels of thyroxine or TSH. The TSH levels consistently started going up because the supplementation had stopped. Proportionately, the colitis symptoms came down. The patient is going to a general physician for the thyroid problem and the patient is going to a gastroenterologist for the colitis. They don't relate each other's condition to, one is putting on the brakes, one is pushing the accelerator. So the patient is suffering. So when we did this, somewhere we had to settle down to TSH levels which are higher than normal, about 12 to 14, but the patient was having peace of mind. The number of bowels were down to 2 in a day, but we could not get it below 5 and still manage the control over the colitis. So just going by the reports, sometimes it may be a little deceptive. We have to correlate subjective and objective conditions. Everyone may not fall into the normal zone of normalcy or the recognized zone of normalcy. Some changes or deviations may be there and should be considered normal or about normal, because there are variations. We don't come in standard size and shape. We don't come in the standard makeup. There is something known as prakriti, or the body type, or the body's blueprint. It varies from individual to individual. There are different manasika prakritis, the mental makeup. There are different sharirika prakritis, the bodily makeup. You have heard about, are you familiar with Vata, Pitta and Kapha? These are the three doshas. These are the three biological systems controlling the entire biological system, be it mind or the body. So there is an excess or diminution of either of these, which brings us to a state where there are 7 different prakritis: Vata, Pitta, Kapha, Vata, Pitta, Pitta, Kapha, Vata, Kapha, and Tridosha or Tridosha prakriti. So these are 7 kinds of body types. A Vata prakriti person is generally seen as an anxious individual, restless individual, but highly energetic and highly active. May not be a perfectionist, but an individual who only believes in working, working and working. In contrast, we see a Shleshmala individual who is very slow and steady and perfect to the last detail. And we see someone who is brilliant in memory, excellent metabolism, medium stature. So there are so many variations. In each topic is going to take a long time to narrate and explain to you. But there are some differences. We don't come in standards. The medicine, because I touched upon this point because of the big word which is used, standardization. Ayurveda does not have standardization. I accept standardization may not be there, but we don't come in standards. So when there are so many variables, we need to observe both subjectively and objectively and reach a point where the individual is going back to the domain of health. This is one more, EMG NCV study. I don't know whether it is clear. This is a condition which said demyelinating type of axonal degeneration at L4 S1 level and L5 S1 root level. So degeneration and demyelination. This is something which I wanted to focus upon.
This we can't understand, brother.
Yeah, demyelination is a condition which multiple sclerosis is one example of a disease which is crippling, which affects about 20 to 35 years age group and more so in ladies. It's a very, very crippling disease where system by system starts getting paralyzed. It can be sensory, it can be motor, some lose their eyesight and hearing ability, some lose their sense of smell, some cannot walk, some cannot sit straight, some cannot sense a normal sensory. So multiple sclerosis, depending on where it is affecting in the brain, the demyelination, or if we consider the neurological system as an electric cable, if the insulation is chipped out, there can be short circuits. It's a similar thing happening in our brain when the myelin sheath or when the insulation is chipping out. It starts creating a paralytic situation, whichever area that part of the brain is controlled. So we could get a normal EMG NCV study. This is a test which EMG or electromyogram and nerve conduction velocity test is a test for functional aspects. Previously we saw a test for structural aspects. So structurally we could achieve something. In this case, functionally we could achieve something. All the way the patient is getting better, but once we see these reports, and yes, we can confirm the patient is getting better from the basic problem. So this is something which the population today needs. And believe me, none of these patients came to us with Ayurveda as the first or primary method of healthcare. So if the best thing in the best institution and the highest of the medications or the strongest of the medications is already done and the patient is not getting better, and at that stage they approach Ayurveda and we do with a combination of medications, therapies, detoxification, and if this is the result which we can show to the world which is possible, then managing degenerative disorders and autoimmune disorders can be termed as superior in Ayurveda compared to today's systems of healthcare. I am not exaggerating, because these patients have tried everything possible. At that stage, if you can still have something down the sleeve, if you can still give comfort to the patient, even after the best of the Western system is, done, and then, so that shows we are superior. It has to be streamlined, it has to be more organized. Ayurveda has to be practiced by qualified practitioners in large numbers. Today, it is very difficult to find a quality healthcare institution dedicated to Ayurveda. Conditions like this gives us so much of excitement, but when we turn back and see we can't get 20 practitioners having proper practice or doing an organized method. There are hospitals in Jaipur and in Banaras Hindu University, Jamnagar. We have the former dean of Jamnagar Ayurveda Institute here, Professor Harishankar Sharma, amongst us. And down south in Kerala, Kottakkal, and in Coimbatore, Aryavaidya Chikitsalayam, when patients are trying to, book their, appointments, they have to wait for 3 months, 6 months. This is the scenario. And patients are ending up going to wrong places in Kerala, coming back with bad experience. Because the institutions which are dedicated are running so full. So today there is a need for bigger institutions, better practice, and if this is what we can achieve through Ayurveda, which neither the orthopedic or the neurological aspects or specialists can help much beyond a point. This is a condition of hepatitis C, related hepatomegaly and fibrosis. Liver fibrosis or liver cirrhosis is a very scary thing. It leads to something known as udara or ascites. So in this patient with hepatitis C being positive and grade 2 liver fibrosis, which is a very bad situation, after about 6 months of medication, simple medications. We all know about Gulancha or Guduchi or Giloy. This was the basis of treatment. Kala Jeera or Nigella sativa. We know about Kala Jeera. This is supposed to have a very, very high level of interferon, which very scientifically works as a potent antiviral. People nowadays fail to understand that antibiotics don't work on viruses. Antibiotic works on bacterial and fungal aspects. But unfortunately, the viral domain is left unattended. So this is where simple things. If I tell about interferon, it becomes a very scientific aspect. If I talk about Kala Jeera as the treatment, becomes skeptic. You will become skeptic. But this is what we use here after about 6 months of just Kala Jeera and Guduchi based treatment. We could get a normal state. No evidence of fibrosis. This is possible. If we can reverse the pathological damage which has happened to the liver structurally and functionally. The viral load in RNA replication test is less than detectable limits. If the structural improvement is showing grade 2 fibrosis of liver or cirrhosis of liver going back to normalcy, then this is something amazing which the allopathic practitioners have to be open to accept and recommend and at least suggest there is an alternative.
Kala Jeera itself contains interferon.
Yes,
Stimulates the synthesis of interferon.
It contains interferon.
It has been estimated.
Yes, yes. You can see that on heaps of information are on the net. You can see that. And one more. Very sadly, there are heaps and heaps and heaps of research happening on Ayurvedic herbs. Still the practitioners don't prescribe it unless it comes through the pharmaceutical industry from the West. So Indian system of medicine, Vedic system of medicine has been in practice since thousands of years. Let us keep doing what we are doing unless someone strongly proves that it does not work. No one is putting an effort to say it does not work. No one is putting an effort to say it works. In between, we are skeptic whether it works or doesn't work. Should we try? Should we not try? So, getting caught in between this. Again, very recently, about 3 weeks back, we saw about Bilva Patra, the leaf of bay. It contains an anti-cancerous agent or a chemotherapeutic molecule and a broad spectrum antibiotic. So, bay is such simple, it is available. We can use it the way we were using it. Tulsi, we can use it the way we were using it. One striking example is so much of research, so much of findings have been, established on Tulsi. Simple example, Tulsi. Still, none of us make Tulsi like a sabzi and eat it. We don't, because it is required only when there is a disease in the system. Some things cannot be used as a preventive method. Chyawanprash, that is something that can be used as a preventive, method or preventive medication. Amalaki. So there are a number of things which we can inculcate in our daily practice. There are a number of things which have to be used only during a disease process. So all this, why I am taking the help of the modern diagnostics at least, it proves, it shows that we can achieve something. These are some of the reports, these are some of the cases, these are some of the studies which specifically point to areas where the allopathic or conventional system has very limited avenues in treating them. There are a number of conditions which we, as Ayurveda is a complete system of healthcare, there are endless number of conditions, of course keeping in mind the limitations and possibilities. So with some of these examples, I want to conclude this session. We'll have a question and answer session, we'll have an interactive session. Before that, I want to say Ayurveda is not only a home remedy. Ayurveda is not only someone giving pudiyas. Ayurveda is a very, very organized system of healthcare. It has equivalents of pharmacology, it has equivalents of toxicology, general medicine, everything. Grammatically, it is different in many ways compared to the allopathic system. There are number of similarities also. As we know, the domain of yoga for mental and spiritual upliftment spread across 8 steps: yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, samadhi. Unfortunately, yogasana and dhyana are representing yoga nowadays, world over. In a sequence of 8 steps, the world is only thinking yoga is asana, which is the 3rd step, and dhyana or meditation, which is the 7th step. And of course, pranayama, nowadays because of awareness being created. So it cannot be done in bits and pieces. The initial conditioning is necessary. There is a sequence, this is a science. It has a very, very systematic method of study. Information is classified very scientifically. When there are differences, we need to accept those differences because there is a purpose behind the difference between allopathic approach and Ayurvedic approach. When there are similarities, like for example, as I said, in case of anemia, iron deficiency is there, iron can be supplemented. So in Ayurveda, in the Vedic term, lohita means blood because it is made of loha, iron. So once there is a deficiency, you can make it up. This is common to most systems. Homeopathy differs from this, of course. So there are differences, there are similarities between allopathic and Ayurvedic systems. Where there are differences, there are gross differences, and these differences are with a purpose, and this is the things what we can achieve if Ayurveda is practiced in the proper manner. I look forward to a day where we find statistical relevance. This is where Ayurveda is lacking, seemingly lacking nowadays. We don't have 100 cases of liver cirrhosis treated, out of which 50 got well, 10 dropped out, 2 did not survive. No, these statistical relevance is what we are lacking nowadays. Once there are practitioners in large numbers, once there are beneficiaries in large numbers, we can establish furthermore the scientific relevance of Ayurveda as one of the major systems of healthcare in today's world. Can we identify what this is?
Bill.
This is?
Methi.
Methi. This one?
Anar,
Anna.
Adrak.
So we know something. If we throw away chilies and salt and commercially available oils from the Indian kitchen, everything is a multivitamin what we take. Every spice, every herb what we use in the kitchen is jam-packed with minerals and vitamins. Unfortunately, we are spoiling it ourselves by using excess of oil, excess